Good afternoon. I am Suzanne Lawson with Constellation Consulting, and we are pleased to present the New Mexico 2021 Summit on Health Equity. The summit is funded by the New Mexico Department of Health Tobacco Use Prevention and Control Program and will take place throughout May on our event app with live sessions each Wednesday afternoon. For more information about the summit, please visit our website at nmhealthequity.org. Due to COVID-19, this year's Summit on Health Equity remains an online event. We appreciate those who have participated and supported this year's event, including the New Mexico Department of Health, our Summit Planning Team, Presbyterian Healthcare Services, Con Alma Health Foundation, Be Well NM, the Santa Fe Community Foundation, and others. For a full list of our supporters and online exhibitors, please visit our event dashboard online or on the Whova app. I also encourage you all to utilize this year's Summit on Health Equity event app. The Whova app provides you all with opportunities to network online, schedule COVID-safe meetups, create discussion groups, visit our exhibitors and supporters, watch recordings of sessions that you may have missed, download files provided by our presenters, and more. It is a great tool for you to use not only during our live sessions, but also throughout the month of May. Plus, when you use the app, you can earn points, which could mean prizes. Please check the leaderboard in Whova for more information. For our session today, attendees' webcams and microphones have been disabled. If you have a question for today's presenter, please use the Q&A function within Whova, and we will address as many questions as time allows during the Q&A. Also, any materials provided by today's presenter will be posted as part of this session within the event app. Following today's session, we appreciate if you take a few moments to complete our session feedback by clicking Rate in this session of the Whova app. If you would like to request community health worker or social worker CEUs or continuing medical education units, please include your name and email address on your evaluation, and CEU certificates will be emailed out within 60 days. If you need assistance with CEUs, please email us at info@constellationnm.com. If you need assistance during this session, please utilize the Q&A feature or the Ask the Organizers feature in Whova. You may also try emailing us directly at info@constellationnm.com. Constellation Consulting acknowledges that our organization operates primarily on the unceded ancestral homelands of the Tiwa-speaking peoples. Racism has no place in our communities. Constellation Consulting and our team members are committed to racial equity. We acknowledge and denounce the violence and discrimination affecting the Black and Asian and Pacific Islander communities with whom we stand in solidarity. We are New Mexico, and we are built strong by the diverse people of our communities. There are a variety of organizations supporting health equity throughout our state. We have listed just a few here and encourage each of you to seek out, learn more, become involved with, and support organizations who are building a better New Mexico for us all. And today we are excited to host Dr. Jennifer Gomez-Chavez as our first presenter this year. Dr. Gomez-Chavez has 30 years of experience working on issues of diversity and equity. She holds a BA in criminal justice, a master's in counseling, and a doctorate in educational leadership. Dr. Gomez-Chavez is currently the Special Assistant to the Associate Vice Chancellor in the Office of Diversity, Equity, and Inclusion at the University of New Mexico's Health Sciences Center. You can read all of our presenters' complete bios in our event app and on our website at nmhealthequity.org. Please welcome Dr. Jennifer Gomez-Chavez.
Buenas tardes, everyone. Thank you so much, Suzanne, and all the team with Constellation Consulting, as well as the Department of Health and all the wonderful sponsors for hosting such important conversations for the greater community. And so thank you again for being here as I introduce you, or maybe reintroduce you, to Collective Impact, a framework to grow equitable, inclusive organizations as we all are working toward addressing health disparities, educational disparities, and many other concerns that I know each of us are working every day on. So, So I want to introduce myself again. Jennifer, my pronouns are she, her, and ella. And I want to tell you that I too would like to honor the land that we are on at the University of New Mexico, as well as throughout our country, and that's our native lands. We want to acknowledge our Native American ancestors, their history, and their culture. I also want to let you know that I am a proud Mexican American, first generation to this country. I am an educator, a health and policy advocate, a mother, and a person living with a disability, multiple sclerosis. And I'm sharing my picture here because I just participated in the MS Walk. But I want you to know that as I come to you addressing and presenting on collective impact, that I have used my personal, professional experiences and perspectives to become an equity champion and to utilize the collective impact framework to help me in my everyday work. So today, what I'm hoping that I can share with you and that you can learn is what is collective impact model, the collective impact in action, collective impact challenges, and how to be an equity champion. And I might add that, this is one of many models. And this isn't a perfect model. So this is one model that you can consider as you are working on your different initiatives. So a lot of people ask me, why collective impact? And most recently, I think in the last 2 years, because of the national climate, we have seen national organizations really want to address the inequities. And so a lot of different individuals and organizations have been reaching out to me, and I have guided them and I have recommended that they use a collective impact framework to address some of their work. And I'm going to teach you a little bit. I'm going to share a little bit about that model with you. But I want you to know that this training, learning how to use the collective impact model, is not just a one-time quick training, right? This is years, months of understanding it, also applying it. So today I'm going to give you a quick overview, but hopefully you'll be able to gain some skills that you can begin to shift or to evaluate through a collective impact lens. So again, the national movements to address inequities, I think all of us are trying to do the best we can in our different organizations, because we do feel that we want to be an equity champion, and organizations are really wanting to address the different issues. So, I have been doing this work, collective impact, since 2008. And you'll learn a little bit more on how I got involved with it. So I have training on collective impact. And professionally, the reason I lean on collective impact is because I notice that oftentimes in our work, we think that we are collaborating or we say we're collectively impacting our communities, but in fact, we are collaborating. So you'll learn a little bit about that. But professionally, I saw the benefits of using the collective impact model. And then personally, you know, as I shared with you, I am a person living with multiple sclerosis. I work, you know, hand in hand with the disability community. And as I went through the process from working with organizations to the healthcare process, you know, to advocacy, what I found is that a lot of great work was being done. But again, it was being done in collaboration. It is being done sometimes in silos. And so what happens, right? And like what happened to me and can happen to others who are facing health issues is that we're found to be having to navigate different systems. Instead of working with one unified collective system, we're found to have to learn how to jump through different hoops. And I have an education, as you have heard, but sometimes, you know, people who don't have the resources are marginalized communities who might not have individuals who can help them get lost and give up. Right? So, you know, the collective impact framework moves us from the I to the we. And I think it's really important as I go through this to understand that if you are in the I or if you are in the we. Okay. And collective impact gives us the opportunity to have a greater reach. Now, I've already mentioned that this is one model out of many that individuals use. And no model is perfect, but I have found this to be quite effective in the work that I have done throughout the years. We know that not every organization has all the funding they need to do the work. And what we are hearing from national funding organizations, private organizations, philanthropic organizations that want to invest in some of these social, health, and educational movements is they want us to work together. Right? So they want us to be able to show that collectively we can solve some of our issues and problems. So, for example, here in this model, you can see that in the isolated impact, you know, funders select individual grantees, nonprofits work separately and sometimes compete. Evaluation attempts are very isolated and sometimes, you know, we don't have the funding, but we make it work, right? Whereas if we worked collectively through the collective impact model, all players come together, all stakeholders come together, and they do cross-sector alignment, and they work together to really solve our problems instead of trying to solve them alone. And again, you know, as you look to seek funding, I know in the educational realm, we are constantly pushed to invite other partners, other stakeholders in the movement. They're no longer funding just individual projects. So I do want to mention, you know, that education and health equals improved health outcomes. And there was a recent report that was just released now in March, and I have it here on the screen. And it states, now more than ever, People who have not graduated high school are more likely to report being in fair or poor health compared to college graduates. So I bring that to light because given that I work at the University of New Mexico, and given that education is important, and I do want to also mention that because of the pandemic, we have seen great inequities in education. And my passion is education, to help our students, our families, reach their full educational attainment. Because I do believe that, educational attainment is a predictor of health, and it can affect the health outcomes. So the model that I'll be using today as I talk about the collective impact model is one of the first models that I got involved in, which it was based on a collective impact framework. But right now, I am challenging each one of you to help us, help our community, help our students realize their full potential, and remind them not to stop, not to drop out, not to stop out, but continuing on their educational journeys. Because what we're seeing now is a lot of our students either dropping out, stopping out, or not moving on to post-secondary education. So a quick guide as I get into it is that I want you to spend these next moments and begin to evaluate your own organization and your own work. I want you to think about, are you collaborating or are you practicing collective impact? Because there is a difference. So as I go through this presentation today, I want you to really think about that. And then I want you to also think, what steps can move you from collaboration to collective impact? And are you an equity champion? Oftentimes we believe that we are doing all of the things that I have listed here, but sometimes it's a good reminder to do a self-check, to say, am I really doing a deep, is my work making an impact? And am I moving in the right direction using the collective impact framework? So let's get into it. So what is collective impact? And so collective impact is a goal. The goal is to solve a complex problem. And it can be within your organization, it can be within community, it can be even a national goal. And what the focus is to really bring separate organizations come together to work on that specific problem. And I think what really makes collective impact different than some of the other frameworks is that we are looking to make systemic changes. Oftentimes, we are looking to make changes in individuals. For example, we tell individuals, eat better or go to class, right? It's individual behavior. But what we sometimes forget to look at is the systems, the institutional systems that provide services, right? So we want to look internally to say, why do we continue to see these inequities? Again, we oftentimes want to just place the change on the individual, but we also need to look at the systems on how we can change those to be more inclusive and effective for true change. So here's the definition. I want to mention that the collective impact framework did come originally from the business community, but because it was seen as a promising practice, many other organizations, as well as educational institutions, as well as national foundations, took it on as the framework to begin to do their work. So here's the definition, and it's the commitment of a group of important actors from different sectors to a common agenda solving a specific social problem. So a question that I often get is, what is the difference between collaboration and collective impact? And if you can look into your own organizations and your work daily, you know, we do a lot of collaborating, right? We are typically, you know, we have a goal or we have an initiative. So we're like, okay, which partners can we bring in? So you bring the partners, we convene around certain initiatives. We want to try to prove something. We want to, we add it in addition to what we're doing, right? So we kind of just build on another program. And then we ask people, okay, what are your ideas? And we throw something together and we move forward. In the collective impact framework, we actually work together to move toward outcomes. So we want to improve on what we're already doing. And we want to bring in as many voices. Okay, oftentimes when we're collaborating, we just think about that one area that we're working on. And in collective impact, we are looking at involving from community to organizations, to student voices, to policymakers, right? Because we want to move toward outcomes and we want to improve. We just don't want to do an initiative. We want to improve on what we are already doing. And we want to advocate on what works. So there's continuation of follow-up. There's continuation of measured outcomes. And even though collaboration is really important, oftentimes we miss a lot of the steps to make a true impact. So people say, well, give me an example, right? And being in education, I use the example of increasing graduation rates. We all know that that is such a hot topic, and even more so now because of the pandemic, how graduation rates were increasing, and now they're worried that we're decreasing because students are not doing as well. So what do? We collaborate, we bring partners together, and we try to really think about quick initiatives that we could put together. But in collective impact, we really study the issue and we go deep so that we can understand, you know, it's not only this, you know, learning about the difficulties that students are having, but it's learning about our systems. And I'm going to tell you that all the policy on our broadband that has just passed, and thanks to our leaders, they were doing a whole lot of collaborating at the beginning, but now they're going to have to do a lot of collective impact because we found, right, that our idea was to increase broadband across the state. But now we are really going to have to begin to make systems change to ensure that every community has the opportunity to connect in ways that we had envisioned. So that I wanted to just talk a little bit about collaboration versus collective impact so that you can better understand the difference. Now, I did have a video for y'all, but YouTube seems to think, because we're using Zoom, that there are some difficulties that it won't allow me to use it, but I'm going to include it in the follow-up notes for you. And I'm excited for you to view this because in 2 minutes, it basically outlines what collective impact is. So I want to talk about now about one of the main principles of collective impact. And there are actually 5 different principles. And the first area that we focus on is coming up with a common agenda. So in collective impact, all participants come together to form a vision for change. And sometimes it's difficult, right? Because we all have the way we want to address a problem. Sometimes other problems that we represent in different communities are very different than our other colleagues. So we have to, in a collective impact, one of the first things that we have to do is come together to really look and define what a common goal would be. So I'm going to give you an example. As I told you, one of my first collective impact initiatives was actually to address Latino student success across the nation and across our state. And so Lumina was the funder that used the collective impact framework for all communities. We were, Albuquerque was one of 13 communities in the country that was selected with this big collective impact goal to increase degrees in credentials by the year 2025. And the reason I show you this is to give you an example of what a large collective impact goal can be. But you within your organization, you can set your own individual goals. It doesn't have to be a large societal goal, in other words. So when you're trying to reach the common agenda, when you bring people together, and typically it is a steering committee, somebody who says, you know what, I want to implement collective impact because collaborating might not be working, or because you identify that other organizations are working on the same issue that you're working on, right? So collective impact, somebody might say, I want a collective impact framework to bring everybody together. So in that environment, you have to lay out principles on how the group will work, right? Because you all have different perspectives, you all have different experiences and expertise. And then you have to clearly define the problem as to what you're working on. And let me tell you that there are so many issues and concerns that the US faces, that our state faces, that our community faces, that our neighborhoods face, right? So you have to drill it down so that everybody understands and is able to define, and you cannot possibly solve everything. So with collective impact, you have to really get a goal that you all agree on and that you feel that you can work on together, because you don't want to have too many things going on, because then you dilute your resources and energy. And then from there, you want to really think about your framework for change. As I talked about, this isn't about, let's put a program together, let's put an initiative together. This is about making true systemic, sustaining change. So you have to ensure that everybody understands that. And the stakeholders that you bring need to be ready to go back to their organizations and communicate the importance of wanting and doing and making that change. And then you have to also be ready to learn, because in collective impact, sometimes what you set out to do might not be the right approach. So you have to quickly shift and pivot and create maybe another strategy. Or you have to shift and create a stakeholder that you might have not thought about. The other area that we include is that you want to have a common on shared measurements. You want to be able to figure out, how are we going to measure success, right? And it goes beyond how many attendees do we have? How many people signed in? How many people receive the information, right? You want to look at your goal and really define a measurement where you can track that you in fact are making improvements. So for example, again, going back to the model of collective impact that we had on education, on Latino student success. So all these entities came together, leaders from the public school system, higher education, policy leaders, employers, because remember, they benefit from our educational system, our students who are graduating through our systems, community-based organizations. And I always remind our institutions to lead with patience and compassion and humility, because some of the best ideas and best practices actually come out of our community-based organizations. Also, we had Latino organizations, and all of these stakeholders came. They set a goal, which you saw the goal earlier was to increase Latino student success over in the US, but also in Bernalillo County. And that was our goal. The other area that is really important is mutually reinforcing activities. So as your stakeholders represent different entities, they have the opportunity to have mutually reinforcing activities. So for example, one organization, you may determine, for this problem that we're trying to solve, you build different activities, and one organization might do it at a certain level, another organization might take on another level, so that it's mutually reinforcing. It's not one organization. Remember, in collective impact, we're collectively making systemic changes. So it can't just be in one system. It has to be in all the different systems that influences or impacts your goal. So here, for example, I'm giving you an example of, again, when we look at Latino student success, there were different strategies. We had strategies that were focused in the public school system, K through 12. There were strategies that were focused in community college, which was, students who were getting their GEDs. There were, students who were getting their associate degrees. We also worked on bringing back students who had stopped out of high school or dropped out of high school, to bring them back in to get their associates, or to get back on track to get a college degree. Okay. We also looked at removing barriers at those institutions. What are some of the barriers? So we worked at the K through 12. We did strategies there. We did strategies at the community college level. We did strategies at the university level, and we did strategies at the policy and institutional level, so that, again, we are working collectively, mutually reinforcing activities as one unified movement. The other important aspect of collective impact is continuous communication. And we have seen during the pandemic how that is so important, right? How communication is really critical in anything that you're doing. Whether it is electronic, phone, Zoom, mail, in person, having that frequent communication is important to ensure that all your stakeholders are moving together and are also talking to their own organizations, to their own entities, to their own environments and systems, because together everybody needs to be singing the same goal. And I think this is one of the most challenging times, or most challenging things, is how do you keep communicating? Sometimes it's exhausting, to keep reminding people, this is our goal, this is what we're working toward, or reminding individuals that we are in this together. We are a we and not an I. So for example, I'm using, I thought I'd pull some of these examples, because I think it's really important for you to see models of collective impact. So for example, we actually determined to have a community liaison. What we learned about the collective impact model, especially working with governmental agencies and educational institutions, oftentimes our customers, our patients, our community members do not trust those entities. And why is that, right? And we often ask, why is trust broken? Sometimes it's because we depend on those communities to give us information or to give us research without it being a reciprocal relationship. So what we had to do is we hired a community liaison that the community trusted, that the students and families trusted, and that the organizations, if you can imagine, when you're working with different educational institutions, different entities, including health entities, you know, they sometimes there's a competitiveness, right? Who has more students? We need more patients for money. We need more students for money. And so the community liaison was a nice touch. You don't have to do this in all aspects, and some of y'all may already be doing this, but it was a neutral person, and that person kept all of our different strategy groups in deep communication. So it provides a neutral partnership, it builds trust, you gain a buy-in, and it maintains commitment. Communication is really important, and I will talk a little bit later about cultural relevancy. So anything that you do, you adapt your specific community and culture so that it's reflective of that richness of the individuals, the diverse communities that you represent. So the collective impact model has its own model, but what we felt is that we needed to use our own model. And here you see, we use the ACEQUIA model to demonstrate how our students move in and out of a water system. So if you think of the ACEQUIA as the flow of water throughout our beautiful land, and how you have different components, the gate of the ACEQUIA, you know, increasing the flow that goes to certain areas. You have to clean the ACEQUIA, removing the barriers, right? So, you know, using, and this is why it's really important, because what we found with our stakeholders is they were basically like saying, this isn't representative of our community. You know, some people put pipelines or pathways, but in this particular collective impact, this is very cultural and unique to New Mexico because water is so precious to us. So it's really important to note that in the collective impact model, that a backbone support is often needed. Now, some organizations feel like that isn't important, but I am a proponent that there needs to be at least one entity, one organization, one area that is identified to be the backbone support, because that support needs to help the project continue with consistency, guiding the initiative, right? Because when you leave out of your, you know, meetings and your work, the work has to be continued. And so the backbone organization, which for us was the University of New Mexico at the time, really helped with building public will, helping keeping the momentum, mobilizing resources. So helping us identify a grant writer so that we could continue to be funded. And again, that has to be determined by the collective. So I'm just going to give you a quick, this is the example. The University of New Mexico and Enlace were actually the backbone organization in working to ensure that all these different initiatives continue to move toward reaching our goal. So here again are the 5 conditions. And these 5 conditions are really important to achieve collective impact. And as you can see the movement, creating a common agenda, getting the backbone support, identifying your shared measures, creating mutually reinforcing activities, continuous communication. These are the phases. And again, I just want to add that, again, a reminder that this training can go on for hours, days, and months. So as I go through these, please understand that this is just an overview. But here you can see the different phases if you begin to look at a collective impact. Phase 1, you're generating the dialogue. Phase 2, you're starting to initiate the action. Phase 3, organize for impact. And phase 4, sustain the action. And that is so critical because we often see projects, wonderful projects go and come, but with collective impact, as you create systemic changes, you want to come up with a sustainability plan because it's not about today, right? We want to create that impact for future generations. And sometimes that can be the most challenging piece. So I want to quickly review with y'all some collective impacts in action. I talked about the Unidos project. This is a nice project that is Unite Us, which is out of the health equity. And they are doing a collective impact on social determinants and social needs, moving upstream, right? Again, using that model of movement upstream instead of downstream. Right? So they look at strategies to improve community conditions. They look at individual social needs, providing clinical care, and they have specific tactics. So this is another example. The other model that I want to highlight is the community schools model. And the reason I highlight that is because community schools is trying to provide that holistic support for students in education. And they have healthcare centers, counseling, career development, education for students, families, family engagement. So their whole model is working to collectively help to increase education, health for students and their families, and employment. So I want to quickly address the challenges of collective impact because, as I said, there are no perfect models out there. So it's sometimes there's competing priorities when you start to design and plan. Sometimes building relationships. If we think about all the work that we have done, all the work that you are doing, sometimes we may see ourselves on, having differences. And so we have to heal from those, which is a process. So collective impact isn't a quick process and says, I'm fine with you. It's about, okay, this is where we were at, and this is where we need to go. And it's a lot of healing. And I can tell you, for the community, sometimes and often they have been taken advantage of by educational institutions, other organizations. And so through the collective impact, there's a healing process to talk about those things. And for our organizations, you know, we're doing the best we can, educational institutions. I mean, we think we are providing the best services with some community input, right? But so we're not doing it intentionally, but what I'm asking for now is to be more intentional about how you bring in and work with partners, stakeholders. And again, you're continuing to learn. I'm still learning till this day about collective impact. I'm still learning about the inequities in our community. Also, the keeping people engaged and excited about your goal is a challenge. Sometimes people get tired. So how do you put things in place so that you can continue to engage people and keep them excited? And how do you sustain the work, especially when leaders change? It might be a leader's project that comes in to do, you know, a certain project. They leave. How do you continue that over time without it being about the leader, but more about the work? And then evaluation. How do you evaluate your progress and work? I talked about creating culturally responsive communities, community organizing model, which we did in our collective impact framework using the ACEQUIA. And something that I love about collective impact is that you see this image. When we work in silos, it's isolated impact. But when we get everybody working together on a goal, we are working toward one goal together. Here's another: from silos, from lack of communication, to learning more about individual roles and how we can contribute to that collective impact. Aligning resources, aligning funding, having one message so that we can collectively impact our customers, our patients, our students, our family, our communities. So before I end, I do want to say that it has been very challenging these last few months in our country. And even more so than ever, I'm challenging each one of us to speak up and out, to look at tables that you have the privilege to sit at and look around and see who's missing. Who's missing from our marginalized communities? Who's missing? Maybe there's different genders that are missing. Maybe different organizations that might not have as many resources or power to be at that table. And speak up and speak out and get them to be included. And then keep learning to become an equity champion. Because as we lead, as we contribute at our own organizations, we can be leading by example. And so through using the collective impact model, it gives you the opportunity to really see who's there, who has the privilege, and who hasn't had the privilege to be there, but yet is doing incredible work. So I challenge all of us to continue to keep learning, to continue to keep fighting for underserved communities, for marginalized communities, because together we are stronger, and we can be the change, and we can be the voice. So I will include some resources here for you. And I just want to thank you again. Thank you so much for inviting me to share the collective impact framework so that you can possibly use it and work with other organizations to decrease the inequities in our health disparities and our educational disparities. And we need to work together more now than ever. Muchas gracias. And I stand for questions. Thank you, Suzanne.
Thanks so much, Dr. Gomez-Chavez. As a reminder for our attendees, if you have any questions for Dr. Gomez-Chavez, please submit your questions through the session Q&A tab in Whova, and we will address as many questions as we can during the time allotted. So while we give people time to submit their questions, I actually was jotting down some, and I submitted a couple myself as we were going. And so a couple of the questions that I had, you were talking about, the various partners that are needed. How do you really build trust, to support the collective impact model between partners who maybe haven't worked together before, or there isn't significant trust there?
So thank you for the question. So I'm going to say it's going to take a lot of patience, and it's going to take time, but you bring people together. You have to bring people together, and you have to start with a conversation. And you look at, what are the assets that your partners have that maybe, first you outline, you kind of do asset mapping. So you look at the different assets that individuals or organizations have, and you build from there. But building trust is all about creating spaces, inviting people to where they haven't been invited to. Recognizing them. And it takes time, but I think initially a conversation and a genuine, authentic conversation on how you want that partnership to work and what is it that they need, right? It's not only what you need, it's asking them what they need. How can you help them?
Okay, thank you very much. Another question that I had was around the barriers. So what are the biggest barriers that you have encountered in implementing the collective impact model? And then how have you overcome those barriers?
Yeah, so I think the biggest barrier is change of leadership. Because when you bring stakeholders in, for instance, our collective impact model was for 4 years was the beginning of it, and then we've sustained it ever since. But in those 4 years, different individuals who were in charge or who were leading some of the strategies left to other jobs, right? So it's the consistency of providing training and resources to the new leaders who stepped in, I think was the biggest challenge. And then the decision makers, because, ultimately collective impact goes all the way to the decision makers because they have to be part of that systemic change. So the changes there in leadership, again, educating those leaders on, that specific, our goal in the different initiatives was quite challenging.
Okay.
But we did it.
Got it. Thank you. And then this may be the last question. How do you best support the collective impact model if a potential partner does not want to participate?
Yeah, and that is difficult, I think, situation to be in. But what we have found is that you can invite people and you can talk to them. If they don't want to be a part of it, then there's not really anything that you can do, but hopefully through your modeling a collective impact and getting others on board, eventually, hopefully that'll create them and cause them to join in. So, and even though they say no once, doesn't mean that you said, okay, we'll forget about them. They don't want to be a part of it. But you can find different, maybe in different activities to engage them that they might want to be engaged with. So those would be some of the ways.
Okay. So I think that is all for the questions right now. We do have several comments that have come in over the chat that just say thank you. We had somebody who seconded one of your responses earlier. Another thank you for sharing your knowledge. So thanks to everybody who has participated on the chat, and we appreciate that. So thank you again to Dr. Gomez-Chavez for your time and expertise today. We appreciate all of your efforts towards creating true health equity in New Mexico. And thank you to all of our attendees for joining us. Please remember to check your event dashboard for more information about our upcoming sessions, including today's session later this afternoon in about 30 minutes, Healing Historical Trauma in the Workplace, presented by Rosa Gallegos Zamora. Thanks so much, everyone. Have a great afternoon.